You know what's become completely socially acceptable in the 21st century? Panicking about mild physical discomfort. Not serious illness, not emergencies. Mild discomfort. I've watched people write paragraphs, genuine, multi-paragraph texts, debating whether a sore throat warranted urgent care or a telehealth appointment. I've seen a grown adult spend 45 minutes on a symptom checker at 2 a.m. over what turned out to be a mosquito bite near the elbow. And I'll be honest with you, I have personally at least once considered calling my doctor for a bruise. We live in a world where every pharmacy shelf is stocked with 17 different formats of pain reliever, where antibiotics exist for infections that a century ago would have been effectively a death sentence, where you can describe a symptom to an app and receive a differential diagnosis in 30 seconds. And we are, somehow, still struggling. Still catastrophizing. Still filling waiting rooms with complaints that would make a medieval physician shrug and prescribe a mild walk. Which is fine. I am not judging. The infrastructure is there, use it. But somewhere in the back of my brain, in the part that sits quietly while the rest of me Googles, is it normal for an ear to itch? Something is doing the math. And the math is uncomfortable. Because 50,000 years ago, a Neanderthal with a shattered arm, no hospital, no antibiotics, no anything we would recognize as medicine, did not die of his injuries. He lived to be approximately 45 years old, and the way he survived is one of the most viscerally disturbing and quietly brilliant things the archaeological record has ever shown us. Let's set the scene properly, because the comfortable version of this story is not the true version. Imagine, and I want you to actually do this, don't just skim past it. Imagine a deep laceration, something serious, a large predator, a fall from a rock face onto an unforgiving slope, a hunting accident involving something much larger and much angrier than you. The wound is open, bone is visible. This is not a paper cut situation. Now you're in a wet subtropical environment, humidity somewhere above 70%. Ambient temperature warm enough that things happen quickly. Biologically, chemically, microbially. Things you cannot see and do not have language for are already beginning to colonize the exposed tissue. Here's what the medicine knows that you don't. Within 6 to 8 hours of an open wound like this, in a warm, contaminated environment, certain bacteria, particularly anaerobic strains like Clostridium, have already established a foothold in the damaged, oxygen-depleted tissue. The process of necrosis has begun. Dead tissue is accumulating. That tissue is now a food source. It is also a factory for bacterial toxins that, if they reach the bloodstream in sufficient quantities, trigger sepsis. Sepsis is not an infection. It is your own immune system catastrophically overreacting to infection, a physiological emergency that, without modern intervention, kills the majority of people it reaches within 48 hours. 48 hours. Not weeks. Not a slow, tragic decline. 2 days of exponential biological catastrophe, and then you're done. So I want you to hold that timeline, because what happens next is not a folk remedy. What happens next is a medical intervention of almost absurd sophistication, developed with zero access to germ theory, zero access to chemistry, zero access to anything except millennia of watched wounds and cataloged outcomes. And it works. Let's start with the thing that will make you want to close this tab. There are flies. And in this scenario, the flies are not the problem. The flies are part of the solution. When an open wound becomes infected and necrotic tissue begins to accumulate, certain species of blowflies, particularly species within the genus Lucilia, the common green bottle fly, lay their eggs in that tissue. Within 24 hours, the eggs hatch. The larvae that emerge, what most people would call maggots, immediately begin to feed. And here's the part that sounds like a mistake. They eat only the dead tissue, not healthy tissue, necrotic tissue. Specifically, necrotic tissue. This is not a coincidence. The larvae secrete proteolytic enzymes, chemical compounds that break down damaged, dead, protein-rich material, and then consume it. Healthy living tissue is physiologically distinct at a chemical level, and the larval feeding mechanism does not engage with it. The maggots are, in the most literal biological sense, precision instruments. They consume exactly the substrate that would have killed you, and they leave the rest alone. The effect is called debridement, the formal clinical term. And when a wound is properly debrided, the bacterial population collapses. The necrotic tissue that was feeding the infection is gone. The wound bed is clean. Healing can begin. The FDA cleared the medical use of sterile Lucilia sericata larvae as an approved wound treatment device in 2003 for diabetic ulcers, pressure sores, non-healing wounds. Today, in hospitals, with regulatory approval. The Neanderthals figured out the functional version of this at some point during the Middle Paleolithic, roughly somewhere between 40,000 and 250,000 years ago. And here is the thing I need you to appreciate. This is not guesswork. This is not romanticization. Behavioral evidence for the deliberate management of larval activity in wounds appears across multiple indigenous cultures. The Ngemba people of Australia, Mayan healers in Mesoamerica, who reportedly wrapped wounds in blood-soaked bandages to attract flies. Documented accounts from 16th century European military surgeons who noticed that soldiers with maggot-infested wounds survived at higher rates than soldiers whose wounds were kept clinically clean. The French surgeon Ambroise Paré documented this in the 1500s. Confederate surgeon John Forney Zacharias applied larvae deliberately to gangrenous wounds during the American Civil War and reported it openly. The knowledge kept being independently rediscovered because the knowledge was correct. You didn't need to understand bacteria, you needed to watch what happened to the people who survived versus the people who didn't. And eventually, through the ruthless, unforgiving mechanism of observation in a world where the wrong guess killed you, someone reached the conclusion that this particular type of wound, managed in this particular way, resulted in outcomes that other wounds did not produce. I don't know how long it took to formalize that knowledge, but I know it happened, and I know it was right. Now let's talk about the pain. Because here's where the story gets a second layer of disturbing, and this one lives in a cave in northern Spain. El Cedron is a karst cave in Asturias, and it contains the fossilized remains of at least 13 Neanderthal individuals. The assemblage dates to approximately 49,000 years ago. In 2012, a research team led by Karen Hardy and Stephen Buckley analyzed the dental calculus, fossilized plaque, from 5 of those individuals using pyrolysis gas chromatography and mass spectrometry. Dental calculus is extraordinary. It is a biological time capsule. Anything that goes into your mouth, food, plant material, anything you chew or ingest, leaves a chemical signature trapped in that calcified plaque, preserved for tens of thousands of years. What Hardy and Buckley's team found in those teeth included chemical markers for yarrow, Achillea millefolium, and chamomile. 2 plants that have something critical in common. They are both bitter-tasting, nutritionally poor, and essentially useless as food. There is no rational dietary reason to put these plants in your mouth. Achillea millefolium contains natural compounds including salicylic acid derivatives, the molecular family that aspirin belongs to. It is anti-inflammatory. It reduces fever. It modulates pain. Chamomile contains apigenin, a flavonoid with documented anxiolytic and mild sedative properties. These are not coincidences of chemistry. These are the specific pharmacological properties you would want in a substance you were using to manage trauma. And the 2017 follow-up analysis, published in Nature, found something that made the 2012 finding look almost conservative. A Neanderthal individual at El Cedron who had a visible dental abscess in his jaw and evidence of intestinal parasites, someone who was, in other words, in genuine active pain, had chemical traces of poplar bark in his dental calculus. Poplar bark contains salicylic acid, the active ingredient, the thing we synthesized into aspirin and convinced ourselves we invented. And alongside the poplar, genetic sequences from Penicillium mold, a natural antibiotic, in the teeth of someone who was actively infected and in pain 49,000 years ago. I want to be precise about what this means and what it doesn't mean. It doesn't mean these Neanderthals understood biochemistry. They didn't know what salicylic acid was. They didn't have a name for it. What they had was something more fundamental. They had watched across generations that certain plants, the bitter ones, the ones you wouldn't eat for pleasure, changed outcomes, reduced swelling, lowered fever, made the pain something survivable. And they filed that observation away in the only hard drive available: collective memory, transmitted through practice, through behavior, through the accumulated wisdom of every healer in the lineage who had watched someone get better and someone get worse and tried to understand the difference. That is what we call empirical medicine. And they were doing it while we were still approximately 45,000 years away from inventing writing. And then there is Shanidar 1. This is where the story stops being biology and becomes something else entirely, something harder to categorize. Shanidar Cave is in the Zagros Mountains of what is now Iraqi Kurdistan. In excavations conducted between 1953 and 1960, archaeologist Ralph Solecki uncovered the skeletal remains of at least 10 Neanderthal individuals. The specimen labeled Shanidar 1 is, by any reasonable metric, one of the most significant fossils in the entire history of paleoanthropology. He was male. He was old, somewhere between 40 and 50 years of age at the time of his death. And his skeleton is a catalog of damage so extensive that researchers who study it describe it with what can only be called stunned precision. His left eye socket shows evidence of a severe blow received in childhood, probably before he was 10 years old. The trauma was significant enough that it likely destroyed or severely compromised the vision in that eye. His right arm, the entire forearm, had atrophied dramatically, the radius and ulna reduced in size, and the arm had been amputated at or below the elbow at some point. The bone at the amputation site shows healing. This was not posthumous damage. The bone healed. He was alive when it happened. A 2017 reanalysis by Eric Trinkhaus and Sebastian Villot confirmed that Shanidar 1 also suffered from extensive bony growths in his ear canals, external auditory exostoses, resulting in profound, probably bilateral hearing loss. To summarize, this individual was effectively blind in one eye, likely deaf, limping from a healed foot fracture, and missing his right forearm, yet survived to between 40 and 50 years of age in the Middle Paleolithic. Let me translate that into ecological terms for a moment. The landscape Shanidar 1 inhabited was populated by cave bears, cave hyenas, leopards, and wolves. Hunting was not optional. It was the metabolic baseline of group survival. A Neanderthal who could not run well, could not hear well, could not see properly on one side, and had one arm, was not contributing to a hunt in any conventional sense. He was consuming resources. He was a caloric liability. He survived for decades, which means someone fed him. Someone maintained his wound during whatever process produced that healed amputation stump. Someone, in a world with no margin and no safety net, decided that this specific individual was worth keeping alive. Not because it was easy, not because he provided immediate return, but because he was theirs. Because whoever sat next to him in that cave decided that the thing which makes a group, rather than just a collection of competing individuals, is the decision to carry the ones who can't keep up on their own. That is not behavior we invented in the 20th century. That is not a product of philosophy or organized religion. That is a 50,000-year-old Neanderthal man with one arm. Now here's where I need to slow down, because this is the moment the story asks for a pause. You might have been following along thinking, okay, so they managed wounds, they used plants for pain, they kept their injured alive. Rough but comprehensible, a system that worked well enough, given the circumstances. Here is where the false comfort ends. The intervention that saved a Neanderthal from a necrotic wound, the larval debridement, the plant compounds, the sustained care, required the infected individual to not move, to be kept still, kept warm, kept fed. In a landscape where keeping still meant not hunting, not foraging, burning calories you didn't have to spare, tended by people whose own caloric margin was already stretched across days of difficult terrain and uncertain prey. And the amputation. I've been speaking around it because it's the part of the story that most resists comfortable framing. There was no anesthesia in any clinical sense. There was likely something plant-based. The pharmacological knowledge was clearly present, as El Cidron shows. But no clean pharmaceutical knockout. The amputation of Shanidar 1's arm, whether it was performed surgically or was the result of a traumatic injury that was then aggressively managed, required someone to be close to a wound that was probably infected, probably swollen, almost certainly necrotic in parts. To remove dead tissue, to manage bleeding, to bind the stump in a way that allowed the bone to heal rather than reinfect. The bone healed. I don't know how long it took. I don't know what they used to hold it still. I don't know how many times someone had to clean that wound before it closed. What I know is the outcome. A smooth, healed bone end. A man who lived for decades afterward. 50,000 years before anesthesia. 50,000 years before antiseptics. 50,000 years before germ theory, before surgical technique, before anything we would recognize as medicine in a clinical setting. And someone did this, and it worked. There is a particular irony in the fact that maggot therapy had to be formally rediscovered in the 1920s. Dr. William S. Baer, an orthopedic surgeon at Johns Hopkins Hospital, had observed during the First World War that soldiers with maggot-infested wounds, soldiers who had been left in the field for extended periods, survived at rates that soldiers with conventionally treated wounds did not. The wounds were doing something that the surgical tools weren't. He brought the methodology into clinical settings in 1929 and demonstrated its effectiveness for treating osteomyelitis and open fractures. Then, penicillin arrived. And the maggots went away again, because the pharmaceutical solution was simpler to explain and easier to sell. Then antibiotic resistance arrived, and in 2003 the FDA cleared Lucilia sericata larvae as a medical device. We have now come full circle. The intervention that kept a Neanderthal's wound from killing him in the Zagros Mountains is currently being used in wound care clinics across the United States. The same mechanism, the same biology, the same ruthlessly pragmatic logic of watching what actually works and using it, regardless of how it looks. The only difference is that somewhere along the way, we forgot it. We had to be reminded by the wounds that wouldn't heal. The Neanderthals never forgot. Or rather, they never had the luxury of forgetting. You don't forget the thing that keeps you alive. Here's what stays with me after spending time in this material. Not the maggots, as viscerally striking as they are. Not the dental chemistry, as technically remarkable as it is. What stays with me is Shanidar 1. Specifically, the effort. The sustained, daily, unglamorous, resource-expensive effort that his survival required. Someone changed that wound dressing. Someone brought him food when he couldn't hunt. Someone dealt with the ongoing reality of tending a man who was injured and dependent and probably in pain for years, maybe decades, in a world that could not afford anything resembling charity. He found a way. He stayed alive. We know because the bone says so. And I think about the fact that I have genuinely complained, out loud to other people, about waiting 12 minutes for a food delivery. I have experienced genuine frustration about a painkiller taking longer than 20 minutes to work. I own a heating pad for my back because it sometimes hurts from sitting in a chair. And then there's a man in the Zagros Mountains, 50,000 years ago, with one arm and compromised vision and a healed amputation stump, surrounded by a group of people who decided in the brutal caloric arithmetic of the Paleolithic that he was worth the cost of keeping alive. I genuinely cannot decide if that's humbling or devastating. Probably both. Most true things are, you're somewhere safe right now, roof over you, temperature manageable, no one needs to apply maggots to anything you're currently dealing with. And somewhere in Iraqi Kurdistan, 50,000 years old, a skeleton with one arm is doing absolutely nothing dramatic. It doesn't need to. The bone speaks for itself. If this hit you differently than you expected, subscribe. Hit the bell. Leave a like. The algorithm needs feeding, much like a properly managed wound, and your attention is what keeps this going. We're not done. There is more out in the archaeological record that the textbook skipped over, and we're going to find all of it. Stay curious, and be glad you can do it from somewhere comfortable.